Since Oh, thank you. Since that time, we have continued to place orders or send quarantine orders to every student in the Mondovi School District that is identified as a close contact. And alrighty, I just am gonna go to the next slide. Also get us over. Just to go through some meeting logistics. So you'll just probably notice that the meeting is being recorded. And this is just so we can go back and take notes after today and compile all the answers and questions into an FAQ document that will be posted to the county website as a resource by the end of the week. If all the questions don't get answered during the meeting time, we will provide the questions and the answers to those in that resource document. And that goes for any questions that were submitted to the COVID-19 inbox until 6 p.m. today, or any questions that get posted in the chat box during this meeting. If time allows, we will allow attendees to unmute and ask their questions. At this time, you will have to raise your hand and then we will unmute you. So to raise your hand, you will see in the bottom section of your screen, if you scroll down, a reactions button. And if you hit on the reactions button, you will have the option to raise your hand. And then we can see that. And then after you're done asking your question, we'll just ask that you lower your hand again. That'll help us call on people. And then just as a reminder, the meeting will end promptly at 7 p.m. We understand that there are lots and lots of questions that came into the inbox, and you all probably have a lot of questions you'd like to ask live tonight. So we ask that you put your questions in the chat if they haven't already been answered, and we'll get to them either today in this meeting or in the FAQ document. All righty. Again, head to the next slide. All right. At what point, so the way that we organize these questions is kind of by category, and on the same slide, we put questions in that had similar answers. So the first topic we have are masks. So I'm just going to go through question by question. At what point would the health department ask the district to require masking for all students? So now for this, it's important to remember that the health department has always recommended masking per CDC recommendations throughout the pandemic, whenever masking was recommended. However, we don't have the resources to enforce an order, a masking order that the health department would issue. We do have the ability to enforce quarantine orders, and that's why orders are written for quarantine. But right now we don't have the ability to do that for masking. If you would like to see masking be mandated throughout the school, the first step would be going to your school board and asking them to create a masking mandate. That is something that they can do. What public health indicators would need to be met before Buffalo County Health and Human Services would step in and institute universal masking? So like I said before, we cannot under current circumstances, create an order for masking. However, the public health indicators that we would use could be case activity, characteristics of the Delta variant, vaccination status of the community, and those kind of things. And we are happy to work with the school to come up with indicators for whether they wanted to mandate masks or make them optional. And then again, this question with cases rising in Buffalo County, why can't the county mandate that the schools be mandated to wear masks? especially for kids who are too young to be vaccinated. So this brings up an important point that some people at school are still too young to be vaccinated and to choose to be protected in that way. And a large majority, or not a large majority, but a lot of the students, 11 and younger, are in that category. That's why it's really important that we recommend masking at this time, and that you make the choice yourself to mask yourself or your child, or both, depending on who's going to school. And also talk with your friends and loved ones about masking. Encourage them to wear masks as well. I find that sharing your personal stories about how COVID has impacted you or what masking means to you is helpful in getting other people to also choose to wear a mask. And then that question also answers the why are kids not wearing masks? Can you make Mondovi school wear masks? So we can go to the next question. All right. What can you tell us about the health of communities who are implementing universal masking in schools versus the communities that do not? I really like this question. It's something that I myself am curious about. However, right now there isn't really data showing us the effects of masking policies in schools and how it affects or impacts community transmission. The reason for that is that this school year, there are a number of factors that are different than last school year. So we wouldn't really look at the data from last year. We would want to look at data from this year that includes factors like vaccination status and the Delta variant being much more contagious than any other strain of COVID-19. Being that we're only about a month into the school year, we just don't have that data yet. I am keeping my eye out, as are probably a lot of you, for any data that comes out that is evaluating this. But what's important to remember right now is that we know masks are helpful in preventing transmission. If less transmission happens in schools, this will only help reduce community transmission. So even though we don't have data right now to answer this question, we do know that based on mask effectiveness, it will help reduce community transmission. All right, and so you can go to the next slide. And I'm actually going to have you skip one slide ahead. So we are going to talk a bit about quarantine. You can go to the next slide because I'll come back to this one. Can we go forward to the next slide, Elsa?
It should be on the next slide.
Oh, sorry. It's the what is a close contact slide. Oh, you know what? That is not on there. That's okay. So you can go to the first quarantine length slide. So I wanted to start out by identifying what a close contact is. So you are a close contact if any of the following situations happened while you spent time with a person with COVID-19, even if they didn't have any symptoms. So these situations include: you were within 6 feet of a person who had COVID-19 for a total of 15 minutes or more over a 24-hour period. So that could be within the same day, seeing someone 5 minutes each encounter 3 times. That would add up to 15 minutes. And then you would be considered a close contact if you were within 6 feet of that person. If you had direct exposure to respiratory secretions, for example, being coughed or sneezed on, sharing a drinking glass, utensils, towels, or other personal items, you would be a close contact. If you had direct physical contact with the person, for example, hug, kiss, handshake, high five, you cared for a person who has COVID-19, you lived or live with a person who has COVID-19, or you stayed overnight with them for at least one night in the same household. I think that sets us up to answer these next questions. So, what does the county consider to be a close contact exposures? So we consider everything that I just outlined to be a close contact. If a child does not have a direct contact exposure, why do they have to quarantine? For example, an entire class had to quarantine for a non-direct exposure. Was that necessary? Why can't second, third hand exposures just monitor for symptoms and test after X number of days? And if they're negative, they can return to school. So we know that being a close contact does not mean you necessarily have to have direct contact with the person. You can be within 6 feet, or you can come in contact with their respiratory secretions. This you might not be aware of, but a good example of this is, if you're standing next to someone in a choir and they're singing, it's likely that they are going to excrete some respiratory secretions. Or if you are in a small confined space, for example, a car where someone is coughing next to you, that would put you as a close contact. That's because the virus can be in the air. It can spend time in the air and other people can inhale it or touch it on surfaces, and then they put their hand in their mouth, their nose, or eye, and then they can become infected. Alrighty. And then why can't second or third hand exposures just monitor for symptoms? Why do we have to, sorry, I'm going to go to the next question. I thought it was close contacts had to quarantine. There's no way that all of them are that close long enough. Why is an entire class having to be quarantined? So with this question, what we take into consideration is those other indirect exposure pieces. For instance, if a classroom, within a classroom, children are getting up and moving around or working with other people, or if they're not wearing masks and they're coughing or sneezing, or sharing a lot of the same materials, that is why. I do want to explain the process for identifying close contacts within the schools. So, and hopefully this will help people understand maybe why a whole classroom is identified as a close contact. So when someone is infected with COVID-19, the health department is made aware of that. At that time, the health department notifies the school of a positive case in the school. Okay. And the school then, because they are experts in what the child does and figuring out most accurately who close contacts are, they identify all of the close contacts within the school for that student. Now, they can talk with teachers of the student, coaches of the student. Certain schools have looked at video recordings of recess or things like that to really get the most accurate picture of who is a close contact. So I can assure everyone that the highest effort is being put into identifying who is actually a close contact in the school. Once the school identifies those close contacts, they send a list to the health department, and then the health department will send out the quarantine order to those students. That's how the process goes. All right, you can go on to the next slide. Okay, after 2 years of data collection, what information can you share on the average days from exposure to symptoms? It is hard to believe that after 2 years, we're still quarantined to the original set of standards and not more specific to the actual data. Nearly everyone I know who has tested positive has presented symptoms by day 3. If that is the majority, why don't we let people come back after 3 days of no symptoms and continue to monitor for the next week? So this is a good, really, really good clarifying question. So we have gathered a lot of data with COVID-19. In the beginning, we were having people quarantine for 14 days, and that holds true. That is the best practice based off of what we know and off of the data collected throughout the entire pandemic. However, several months ago, there was new criteria that and standards that were put out for shortened quarantine options based on the data that we know about. So those quarantine options are after 10 days of, you can quarantine for 10 days. And then if you have remained asymptomatic, on day 11, you can resume normal activities as long as you continue to wear a mask and social distance for the full 14-day quarantine. And at 7 days, there's a 7-day quarantine option. And that option would be, you can test on day 5 or 6. And then you can test on day 6 or 7. And with a negative test and no symptoms on day 8, you can resume normal activities as long as you wear a mask and socially distance. So the reason that those shortened quarantines were put into place is because they were able to evaluate the risk level of someone developing COVID after 10 days and 7 days of their exposure. And the risk level was deemed that it is safe enough, but we do need those people to be asymptomatic and continue to wear a mask and social distance. And for the 7-day, get tested on day 6 or 7 with a negative test, mask, social distance, and remain asymptomatic. Because there still is some risk there, so we still do need some mitigation measures, but the risk is low enough that we can allow people to go about normal activities with a certain set of other mitigation strategies in place. All righty, you can go on to the next question or the next slide. All right, so why are parents being allowed to decide when a student without symptoms that has been a close contact of someone who tested positive for COVID can go back to school? Since we know that you can still have COVID and be asymptomatic, why are we not requiring a negative test to return to school? Another great clarifying question. So right now, we know that the risk is lower after 10 days of being quarantined, as long as the child remains asymptomatic. There still is some risk for the rest of the quarantine. That's why we implement the masking and social distancing requirements. We are requiring a negative test to return to school if the child chooses a 7-day quarantine option. That test needs to be completed on day 6 or day 7 and needs to have the result as negative before they can return to school. Even then, there is still some risk, so that's why we ask them to wear a mask and socially distance. Why is it okay for people to go back out into public after a negative test after 7, but our children cannot return to school with a negative test? So I think what this question is asking is for maybe the elementary school at Mondovi, they aren't allowing the shortened quarantine options. And this is outlined in the quarantine order. So with that, the shortened quarantine options may not be available to your child if their school or workplace cannot ensure the following measures: wearing a mask, maintaining 6 feet of physical distance, and avoiding crowds. If this is the case, your child must fulfill a 14-day quarantine period. So that being said, we know that in some school settings, 6 feet social distance isn't able to be maintained, or monitoring each child to make sure they're wearing a mask also is not being able to be maintained. This is why shortened quarantine options may not be available everywhere. But if your child is able to, in elementary school, is able to meet the shortened quarantine requirements outside of school, they don't have to quarantine outside of school as long as they get their negative test on day 6 or 7 and continue to wear a mask and socially distance. All right. Why can't children go back to school after 10 days of being symptom-free? These are the CDC recommendations. This is the same answer that I'm going to give, or that I gave to the previous question. Not every school can accommodate the shortened quarantines for the reasons I previously mentioned. After the above timeframe, these kids are allowed to go back into public with no issues, but cannot go back to school. This has also been answered in the previous question. Could there be an option of when they have a close contact quarantine testing out at 7 days? Yes, this is an option. Testing on day 6 or 7, if it is negative and they remain symptom-free, wear a mask and socially distance, they can return to school as long as they're not in elementary school, and the school can continue to accommodate those things. And that applies to Mondovi School specifically. Why can't we follow a 7-day quarantine? You can, unless you're in elementary school, and that's a Mondovi specific concern. The school board voted to lessen quarantine restrictions. Is there a compromise that is safe? For example, if school implements universal masking, could those with close contact exposures return to school on day 7 if they have a negative COVID test and follow the universal masking? Yes, we did compromise in allowing shortened quarantine options as long as the school can ensure masking and social distancing. School cannot ensure social distancing just based on the student population size and classroom sizes. It's just not an ability that, or it's not a possible thing for every classroom within the school to distance every child 6 feet. All righty, you can go on to the next questions. We're still on quarantine. All right, with a survival rate of 99%, why are you putting such strict restrictions on the virus versus no restrictions other than monitoring for symptoms with the flu, pertussis, etc.? So, while I don't have a data point for the survival rate of COVID, to fact check this piece that this person provided in their question, I am able to tell you that as of today, 672,021 deaths in the United States have been attributed to COVID-19. And we view the measures that we recommend as necessary, not strict, in preventing not only death from COVID, but just the COVID illness itself. Some people are also at risk for long-term side effects of COVID. We don't want people to get sick and infect other people and contribute to the spread that's contributing to long-term illness and death from COVID. It is also essential that we put all of those mitigation strategies together because none of them are perfect in preventing COVID-19. But together, they become much stronger and will minimize risk in COVID spread. And to address the no restrictions other than monitoring for symptoms with the flu, pertussis, etc., I do want to acknowledge that mitigation strategies are recommended to prevent flu, pertussis, and other diseases. These mitigation strategies include flu vaccines, vaccines that pertain things that prevent pertussis, hand hygiene, cleaning and disinfecting, testing, identification of close contacts in some diseases like pertussis. So all of these mitigation strategies have been done historically. Right now, we're just seeing them more at the forefront because we have a pandemic illness, COVID-19, that's at the forefront of many of our lives. What are the statistics of people who actually contract COVID while they are on their 14-day quarantine for being in close contact? Well, I'm not able to tell you a specific statistic of people who turn positive after their 14-day quarantine. We do know that the Delta variant does spread twice as, or is twice as contagious to other people. So we know that it's spreading and getting twice as many people sick from COVID. And we do see every day across the nation, people who are exposed or identified as close contacts becoming sick with COVID. We also know that everyone who is becoming sick with COVID was exposed somewhere, but maybe not identified as close contact because maybe they got it while at the grocery store and they didn't realize they were exposed. So it's really important that even though we don't have that statistic, that we take all of these mitigation measures seriously. All right, and now on to quarantine order questions. What does a threshold of positive tests in the community have to be in order for school to be canceled? We don't have a specific threshold of positive tests in the community for school to be canceled. And in fact, that is a strategy that we only want to put in place if absolutely necessary. It's not something we would take lightly, and it's not something that the health department has considered yet doing. I will mention that Mondovi School was closed earlier in the year to set the school up so it could put more mitigation measures in place in order for less students to be exposed while they're at school, in order to keep more kids in school, to keep more kids safe, that kind of thing. Ultimately, we are constantly thinking about how and strategizing how we will keep the kids and everyone in our community safe. We actually do meet weekly with the schools to talk about this very thing. How can we keep kids safe? How can we keep the staff at schools safe? Why did the county feel it was necessary to send a letter to the school district threatening the district and parents, guardians? So the county, as explained before, responded by putting orders in place for every child identified as a close contact because it is unsafe for people exposed to COVID to come back to school during their quarantine period. We know that those people have a higher chance of transmitting COVID to others and making them sick. Through consultation with our legal counsel, the school, other public health partners, and the public health staff in general, we decided that the best course of action to ensure student safety at that time was to create individual orders. How long is this order for? That's a good question. This question has been asked a lot. So there is not one large order. There are many individual orders, each unique to the student, not unique, but each applied to an individual. So the order applied to an individual will last as long as that person's quarantine lasts. So some orders are already complete because some students that were given them originally are done with quarantine. So it's done. Can you tell me if the new orders are for all Buffalo County schools? If not, why just Mondovi schools? This is also a good question. Right now, we are only placing orders on Mondovi School. Our other schools are agreeing to quarantine close contacts without the county placing orders on individuals. in order for the school to comply with the quarantine recommendations that we put out and guidelines that we put out, we needed to have orders in place. If other schools would choose to take the same track as Mondovi, we may consider that as another option for those schools, because that would be the next step in keeping kids safe. All right, and then for this question, I am going to turn it over to Tom Bilski, our corporate counsel, to speak. And I am going to see if he is on. And it looks like he is.
Josie?
Yep. Can you hear me?
Yes.
Great.
Okay. So what's the question?
What exactly are the charges of contempt going to be?
Okay. So there's two different, the health department, the local health officer is empowered through two different sections of law. One is the administrative code, DHS 145.03, which essentially requires, or actually requires her to investigate and control all communicable diseases. It also requires the school to report and help her, requires any teacher, principal, or nurse serving the school or any daycare center to notify her of any cases of communicable diseases, which in my opinion would also include close contacts. Anyways, that's under DHS 145.05, where she's required to try to use reasonable measures to control communicable diseases. And if people fail to comply with her directives, then as corporation counsel, she would, I would draft a petition to the court to get the school or the school district or whoever was not complying with the order, we would ask the judge for a court order requiring them to comply. So that's kind of the reporting portion of it. But if she issues a direct order, like she did in this case, then as district attorney, if anybody willfully violates one of her orders, and this was set up by the Wisconsin legislature under 252.25, it reads, any person who willfully violates or obstructs the execution of any state statute or rule, county, city, or village ordinance or departmental order, which is the health department, under this chapter and related to the public health, for which no other penalty is prescribed, it says that they shall be imprisoned for not more than 30 days or fined more than $500 or both. So essentially, it's a misdemeanor to fail to comply with a health order. So those are the two ways that the county has of enforcing the orders, either through contempt in a civil proceeding or as a misdemeanor in a criminal proceeding.
Thank you. I have a feeling that you may not have too much to add, but I am going to ask the second question that related to this as well, in case you do have anything to add. The county health department does not have the force of law. They are a non-elected department. They cannot constitutionally create or enforce law. An order is not a law, so what will the consequences be if we don't follow the order? And is it enforceable?
The legislature empowered you to issue orders that are full force and effective law, punishable by 30 days in jail, a fine of $500. So I don't know. I have nothing more to add to that. That's what the legislature authorized you to do. So, my job as district attorney would be to essentially enforce that law and issue criminal complaints against people who are violating your order.
Thanks, Tom. All right, and we can go to the next slide. And I think this, Tom did already speak to this as well, but what authority does an unelected nurse at the county have to determine policy in our school district? So like he said, Wisconsin statute 252 does acknowledge that the local health officer can take reasonable and necessary measures to help mitigate communicable disease and can also quarantine close contacts. I will also add that I do act under an elected board of health and human services. Are other counties forcing schools to abide by county regulations? If so, which ones? So I think it differs. You can see already that it differs by each school district, even within our county, what orders are in place. For instance, other school districts in our county don't have orders because they are complying with quarantine guidance. Other counties are doing what is reasonable and necessary with their circumstances. Every county's circumstances do differ based on the support they have to enforce their orders, their staff capacity, how their schools are complying. In our county, this is what is reasonable and necessary. What is the actual official order? Can I see it or get a copy? Yes, I do have a template that I have provided to some people who have already inquired about this that I am willing to share. The official order really just lays out our quarantine guidance. It lays out that if you're fully vaccinated, you do not have to quarantine. It lays out the symptoms of COVID-19. It lays out the shortened quarantine options. And it references state statute that gives the authority to control communicable diseases. All right, so if you would like a copy, you can request a copy. We may actually consider putting it on our county website also. All right, next slide related to school. So some of these are best answered by the school themselves because they are the experts at their policies and practices. So I'm going to call on the superintendent of Mondovi to answer the first couple questions. I can read them out when we are, let's see. I'm gonna ask. Okay, Jeff.
Yes, I am here.
Great, okay. So are teachers' children still allowed to go to their parents' classrooms even though the school has gone back to cohort model and it is most likely is not their classroom, they are in daily? They were last year, and if still are, what is done for sanitizing after they go to their normal classroom?
That is correct. We do have plenty of staff that have children that attend school here. And so when they get here a little bit early, the children are with them. It is the expectation that they supervise their own children in their classrooms. And so we We disinfect the classrooms on a daily basis. I would say that some teachers probably do disinfect in there. That is not something that I require at this time after their children leave, because what we're dealing with is more of an airborne issue. And so the disinfection of, all of the desks and everything isn't necessarily necessary.
Okay, and you kind of spoke to this already, but if you have anything to add, feel free. But what is done for sanitizing on a daily basis after kids have been at their lockers and not allowed to go back? If no sanitizing has been done, there is still a chance that the virus could be transferred to another student after school when they get their things from the lockers to go home.
Again, what we've learned is that it is transmitted more by passage through the air and not so much by the high touch areas. We do sanitize each night. In terms of lockers, though, I would say we are not doing a full sanitation of the lockers on a nightly basis, because typically it is the same child that is touching that same locker. And so that we don't really consider it a high touch point. High touch points would be more like in the bathrooms, the sinks and the paper towel dispensers and the doorknobs and those types of things that we do try to clean those and sanitize those multiple times on a daily basis.
Great, thanks. And then what other schools or businesses doing what are other schools or businesses doing nationally in regards to less invasive, fast and convenient testing for school? For example, some healthcare workers get a rapid test done 15 minutes before their shift right after work. Is that something the school nurse could conduct or supervise to return quarantined children to school more quickly?
I guess my response to this one is we are not doing any on-site testing. We had a memorandum of understanding with Advent Health to try to get some quick results back from them. Although I know that with the numbers being high, that has been more difficult as of lately. We really do not have the capacity right now at the school for the nurse to take on all the rapid testing that would need to be done at this time. So that's where we're at.
Yeah, and I'm just going to add to that too, that more testing resources are becoming available within the community as the need is increasing. So we actually will be updating the school weekly with what is available that particular week for testing as well. That can actually be shared with parents and staff. Okay, and then what at this point can we do for elementary students that can't get vaccinated to help keep them in school without quarantining the whole class? Or what can we do to get them back to school prior to the 14 days?
Yeah, this has been a huge concern, right? This is what I've been hearing from parents multiple times a day, is that we want the kids back in school. And so we want to try to avoid sending them out as much as possible. And so I know I've been working with our elementary principal. I even met with the elementary staff this evening to talk about things that we can do, such as putting them into seating charts, trying to spread them out and put at least 3 feet. The 6 foot distancing that we do at our 6th through 12th grade is really not possible at the elementary. But what we are trying to do is get up to that 3 foot range, which would really help us minimize the number of kids that we would be sending home. Rather than sending an entire class of 20 kids home, we might be sending only 5, 6, 7, 8 kids, depending on the contact and how close they were sitting. One thing I would stress on this is, the CDC as well as DHS does have it in there that masking can help with this. And I would really suggest parents that you send your children with masks, because if the positive case is wearing a mask and we have a student that's sitting 3 feet away that's also wearing a mask, that student does not get quarantined. That's not a close contact. And so, the more we can do that, the more we can limit how many kids that we send home. So again, in our elementary, in that pre-K through 5, we really struggle to try to get them spaced out. And so again, if we can get out to that 3 foot range, we can do seating charts. And if we can mask the children, that is really the best way for us to keep kids in school.
Thanks, Jeff. I'll even add to that for those kids that are vaccinated or that are able to get vaccinated. Get vaccinated. Now is the time. It prevents illness or it helps prevent illness. And if you are exposed, you don't have to quarantine. That's a pretty easy guideline that we have in place. Alrighty, and that being said, I'm going to wrap into the vaccine related questions. So the first one, are the people who tested positive for COVID vaccinated or unvaccinated? The answer to that is we're seeing some of each, but we are seeing more people who have COVID that are unvaccinated. This data is being shared on a statewide level. It's not being shared county specific, but what I can tell you that it's the numbers that I'm gonna go over are a full month worth of data and last reported on September 15th. And that, so with people who were vaccinated, what they were seeing per 100,000 people, they were seeing about 360 cases of fully vaccinated people per 100,000 people have COVID. Now they can compare that to 1,413 non-vaccinated individuals per 100,000 people. So that's a significantly less amount of people who are fully vaccinated that are actually getting COVID. I'm going to compare that to hospitalizations and deaths as well. So what they saw for that time period is that there were approximately 11 fully vaccinated people that were hospitalized per 100,000 people, and approximately 1 death of a vaccinated person from COVID per 100,000 people. And that compares to about 98 hospitalizations of non-vaccinated people per 100,000 and 11 deaths of non-vaccinated people per 100,000. So what the data is telling us is that less people who are vaccinated are getting sick less frequently, are being hospitalized less frequently, and are dying less frequently from COVID-19 than people who are not vaccinated. Okay. So the next question. If someone who is vaccinated comes into close contact with a positive person, do they have to quarantine? And what is the reasoning behind whether they do or not? So this is another good question. People who are fully vaccinated, meaning it's been 2 weeks since their final dose of a COVID immunization, do not have to quarantine as long as that exposure happened after they are fully vaccinated. This is because COVID-19 vaccines are extremely effective at preventing serious illness, hospitalization, and death. Fully vaccinated people are less likely to get COVID. No vaccine is 100% effective, and as such, we expect some fully vaccinated people to test positive for COVID-19, but the likelihood is much less. Therefore, we do not require people who are fully vaccinated to quarantine. What we do recommend is that they monitor for symptoms for the for the 14 days after their exposure and get tested 3 to 5 days after their exposure. We also want them to wear a mask until they have a negative test within their quarantine period. Okay, the next question. While I understand that lessening safety measures for the vaccinated provides an incentive to get vaccinated, it isn't appropriate for public school system to introduce such discriminatory policy. Unlike adults that can choose where they want to work, if they attend large venues or travel, these children don't have a choice of which school they go to, if they can get vaccinated, etc. We know now that vaccinated individuals can spread the virus no differently than an unvaccinated individual, and breakout cases are very common. If the school's position is that of safety over politics, the policy would be dismissed immediately. Mondovi schools are acting recklessly by lessening safety measures for vaccinated children. What was the idea behind introducing such policy into public school? So the reasoning behind this was based on data and science. We know that vaccines are effective, but not 100%. We do expect some breakthrough infections, but we do also expect protection from the vaccine, which we are seeing in the data that I had recently spoke about. We are seeing less COVID infections, hospitalizations, and deaths in vaccinated individuals than unvaccinated individuals. Hopefully, vaccines will be available to lower age groups soon, so more people can choose to get vaccinated. At the heart of Buffalo County Public Health's decision-making is the safety, the health and safety of our community, including the children that go to school. And I know that the school has the welfare of the children at its best, or in their decision-making. All right, next question. Not sure why vaccinated get treated different than the unvaccinated, since vaccinated can carry and get COVID. So why are we making different rules and forcing kids to fit the agenda of being vaccinated? They don't get the choice, and it is up to parents since they are minors. In making unvaccinated feel they are better than the unvaccinated is just setting up the kids for bullying each other. I feel the rules need to be the same no matter what. Can you explain why you make different rules? So that's simple. We make different rules because circumstances are different among people who are vaccinated and unvaccinated. The same is true for which age groups can get a vaccine. You know, we're still testing vaccines for younger children because their bodies are different and their immune systems have different development than older kids. We treat them differently because they're different. We do value equity and treating people fairly. But right now, it's important that we use data and science to help in our decision making. All righty, and then we just have some miscellaneous questions now to go through, and I'm going to try to get through these at least because we will wrap up soon. If you have a question that hasn't been answered yet, feel free to type it into the chat box. We will see it and record it and include it in our fact and answer or frequently asked questions worksheet that will be shared publicly. All right, so who will be paying for all of the list wages to parents, guardians that will now be missing work for unnecessary quarantine policies? If I were to miss work due to my child having to quarantine, I would either have to use PTO or go without pay. For most families, I know this is not feasible. I'm glad that someone brought this up. So, and the exact links to these resources that I share will be included in that document. But we do have resources for rent and or utilities, and that's the DOA Wisconsin Emergency Rental Assistance Program. And if you need help paying for a bill or other payment, emergency assistance landing page is also going to be linked. We do understand that quarantine and isolation does cause hardship. And if you are facing hardship because of quarantine or because of COVID, please feel free to reach out to your counties. We can help you find resources that you are able to utilize. All right, and then what public health indicators would need to be met before Buffalo County Health and Human Services would recommend closing the school? This was answered previously. We will work with the school to come up with indicators if they would like us to help them with that. And then as you've gathered, everyone has a shared goal of keeping the school open and kids in school. What is our best chance at reaching the school? Great question. So yes, we want to keep kids in school and we want to keep kids safe. Those are our goals. We need all of the mitigation measures in place in order for us to reach this goal, to beat COVID. masking, social distancing, hand hygiene, quarantine and isolation, staying home when you're sick, all of these mitigation measures, because none of them are perfect, but together they work well in preventing COVID. All right, and then all the isolation and being alone is causing severe problems in our children. Does the county not care, or are they not concerned about mental health issues in children and teens? So I really want people to know that we do care about the mental health issues in children and teens. Mental health is public health. Right now, we do take that into consideration in all of our decision making. And if you do need mental health resources, we will put in resources on the frequently asked questions worksheet for issues related to mental health. And then the last slide is just a listing of our vaccination clinics upcoming that are scheduled. So if you haven't been vaccinated and you would like a vaccination, or your child would like a vaccination, please have them come to one of these clinics. They're all walk-in clinics, but it does help us if you give us a call ahead of time or sign up on our website to get into one of these clinics. And that is all that I have. If anyone has any additional questions, feel free to put them in the chat within the next couple minutes, and they will get recorded and put into our sheet. Other than that, have a great rest of your evening, and I appreciate everyone's attendance in seeking clarities to some of these issues. Thank you. All right.